It is an interesting plan. It requires people to buy health insurance. If they don't do it, there are fines. And if they can't afford it because they're below the poverty level, the state will buy it for them. I spoke with Massachusetts Governor Mitt Romney just a few moments ago. All right, a lot of people have said, all right, what has Massachusetts done? And as I understand, the plan is that every individual has to buy health insurance if their company doesn't provide it. And if they're too poor, the state will give it to them or will help them buy it, correct?
That's a pretty fair statement. What we've found is that if you have people who sit outside the system and instead just show up at the hospital when they're sick and expect someone else to pay, that's a free rider system. It's bad health care for them. It's expensive for everyone else. Now we're saying, everybody come on in. We want you to buy insurance if you can afford it, and we also will help you buy insurance if you can't afford it. We look at your income, and of course we subsidize those at very low income.
But how would that work, Governor, say for a carpenter who works for himself, freelances, makes $30,000, $40,000 a year? How can he afford $300, $400 a month for insurance?
Well, he couldn't, and that's why the policies that we're looking at are going to be more like $200 a month. And if a person was making, let's say, $30,000 a year, then they'd need some help in buying that policy. And so we would pick up a portion of the price. If somebody was earning, for instance, as low as $15,000 a year, they pay $2.31 a week. Pretty low number, but everybody pays something. No more entire free ride on everybody else. Everybody pays what they can afford. As their incomes go higher, they pay a larger amount until they ultimately are making $54,000 a year. At that point, they pick up the entire premium, which is roughly $200 a month.
Governments are famous for underestimating costs of various programs. The number I have seen, the state says that they can do this in new money, about $125 million a year. Really?
Well, actually, it doesn't take any new money at all. My legislature has added some new benefits to our regular Medicaid program that account for the increase that you're talking about. What we found is we spend as a state roughly $1 billion a year providing free health care to people who don't have insurance. And the cost of helping those people buy insurance instead is closer to $650 million. It looks like a real savings. Now, we're not planning on generating that savings. We're going to keep that money aside as a special pool in case we've calculated incorrectly. But ultimately, we believe that people having insurance will mean that people go to the primary care physician and the clinic first if they get sick, and that will mean better health care treatment. People who have insurance go to the hospital far less often and have much lower charges when they are at the hospital than people who don't have insurance.
A lot of people are speculating Mitt Romney perhaps runs for president in 2008. A lot of people don't even say perhaps. If he does run, is the health care plan of Massachusetts sort of a foundation for his platform?
Well, I'm not sure about future plans at this stage. We'll let the future take care of itself. But with regards to what's happening in this country, I must admit that I'm pleased with the fact that here in a state that's overwhelmingly Democratic, that a Republican governor could introduce a plan to get everybody insured, work collaboratively with the Democratic legislature, combined with the administration in Washington and our delegation there, to come up with a plan that gets the job done. People want problem solving at the state level, at the federal level, and I hope that at least is passed on to other states.
I'll give up on the presidential questions and we'll address those perhaps in the future. Governor Romney, appreciate it. Thanks very much.
Thank you, Charlie.
The question, of course, is can other states adopt the same plan and make it work? And the governor acknowledged that Massachusetts has a relatively low number of uninsured people, but he said it is a plan that other states ought to look at. Diane?
Well, now we're going to turn to the morning news.